it's the enthusiasm of the doctors, in particular Dr. Peter Keelman, who wanted an input from the patients for the practice.
And it's been really interesting to have the meetings and have the kind of feedback from the group about what things you think are important. Many of them were the same as what we thought, you know, good access by the telephone, appointments, and many aspects of the clinical care, but you know, we just had a few blind spots, like the idea of having more chairs with arms in the waiting room.
Yes.
That was something that, you know,
right.
is just a glaring thing that we hadn't thought about, just because we were being a bit medical.
Because we had this event last year for, was it planning for your emergency, which was, that was really excellent, wasn't it? From your point of view, how did you find it?
Well, I think that showed the strength of the patient group and the practice working together. But this one was thinking ahead for winter, and we really particularly wanted to get people not to just rely on coming to the doctor, but to see what sort of things they could do for themselves. Remember, the policeman talked about having tins of beans and tins of soup and salt in bags in your car and looking out for your elderly neighbours, to keeping fit. Remember, was that very hunky young,
absolutely, from Aberdeenshire,
fitness man who went down very well with some of the members.
The fact that we're slightly elderly does not mean to say we don't appreciate something nice to look at.
And then I talked about the anticipatory care plans.
That's right.
And the fact that lots of things are worthwhile thinking about. If you do get ill, what would you like to be done? We were really very pleasantly surprised when we had over 100 people turned up at that.
We've also had fundraising for acupuncture. Another thing was we had fundraising, a walk, a sponsored walk, which raised money for home BP machines, in that patients could take them for a fortnight and report them to the practice. Well, here at the gala today we have involved quite a number, and we don't specifically pick out patients from this practice, but I think each year on year, we are making ourselves heard and asking people to get involved with patient participation groups.
One of the things I keep saying to folks is that the DPG isn't a greeting meeting for folks. We don't come here to resolve folks' issues. If they've got issues with the practice, and I don't think there's that many, but if they've got issues with the practice, then there's a procedure in place for that. So that's not the role of the Patients Participation Group.